going to test external rotation of your shoulder. So what I'm going to do is I'm going to have you lift your arm up and bring it out this way. Yep, perfect, just like that. And rest your arm on the towel, okay? And lift your arm up. Just from your elbow. Yep, just like that. Okay. Now, can I remove the watch for you, or can you remove the watch?
Yes, I can.
Okay, so what we're looking for here is, this is the olecranon process. This is where the fulcrum is going to be. The moving arm is going to be on the ulnar head, which you can feel right here. And then the stationary arm is going to be parallel to the floor, just like so. I'm actually going to have you scoot this way a little bit more. Perfect. Yep. Go ahead. Okay. Now, what I want you to do is I want you to just go like this, back and forth. Now go up this way. Okay, is there any pain?
No.
Okay, come back to normal. So that's a test for 0 to 2. And now what we're gonna do is we're gonna take the measurement. Okay, so go ahead and bring the back of your arm as far back here as possible. Yep, go ahead. Bring it up one more time. Go ahead and come back down. Okay, now we're stabilizing at the anterior humeral head. What we're looking for is if there's an anterior humeral head glide, we know that she's at the end of her range of motion. And she's not using her thorax to elevate, so she's not compensating. So just go ahead and take the measurement. She is about 71 degrees of external rotation. Active normal range of motion for normal range is about 90 degrees, and she's at 70. Okay, go ahead and come back up. Okay. What this test is basically the active range of motion of the teres minor and the infraspinatus back here. So go ahead and do that one more time for me, and I'm just going to feel for palpation. Yep. Go ahead and come back up and confirm both teres minor and infraspinatus was contracted. So now I'm going to test bilaterally. So go ahead and flip around for me.
Like, on the side?
Yeah, so I want your head over there.
Oh, over here.
Yeah. And then back towards like you're facing up. Same position as you were in before.
Oh, oh.
We're going to test this on.
Okay.
Okay. And bring it out this way. Perfect. Rest your arm. Now we're going to do the same thing as before, okay?
Mm-hmm.
Olecranon on her head, and then go ahead and bring this hand back there. Awesome. And she is at 82 degrees, so she has a little bit of tightness in her left side. Okay, so now we're going to do a shoulder abduction manual muscle test. So what we're going to do is we're going to start her off in a kind of gravity minimized position, just to make sure she doesn't have any pain while she does it, because we don't want to start off with a 3 and she could have an injury. So what I want you to do is I want you to take this arm and kind of lay your palm facing up. Just lay it down for me. And what you're going to do is you're going to slide it. I don't want you to pick it up. I just want you to kind of slide it up, just like that. Yep. Keep going as far as you can. Up. Yep. Any pain?
No.
No? Okay. Come back down. Okay. Now, what I'm going to do is I'm going to stabilize here. Just because she had a thorax elevation, she was trying to compensate. So go ahead and do it again. Any pain?
No.
Okay. Come back down. Okay. So that would be, she would have a 2 on that because she did full range of motion without pain, and it was gravity minimized. So what this is testing as well, we're testing the deltoids and the supraspinatus. Supraspinatus would be activating in the first 15 degrees of shoulder abduction. And this is also testing C5 and C6 nerve roots. So what I'm going to have you do is I'm going to have you sit up here and sit on the chair now. So now we're going to test 3 to 5. Okay, so we're going to do the same motion, except, yep, I'm actually going to do just like that. Okay, we're going to do the same motion. I want you to keep your elbow as straight as possible, and I'm going to stabilize right here, actually, on the upper neck, because I don't want to interfere with the supraspinatus or the deltoid contraction. So go ahead and just lift this up for me. Yep. Any pain?
No.
Okay. Come back down. Okay. So that's a 3. She did it without resistance. And I also felt a contraction in the deltoid and the supraspinatus. So now we're gonna do the same thing, but I'm gonna apply slow pressure. So go ahead and lift it up for me, just like this. Yep, okay, awesome. Now what I'm gonna do is I'm gonna try and push you down, but I don't want you to resist me, okay? Until I say stop, okay? Hold, 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 hold. Okay, you can let go. Okay, you can let go. Any pain?
No.
Okay, so she did a 3 and a 5. We started off with moderate resistance, then we went up to maximum resistance. There was no pain, and I felt a contraction in the deltoid and the supraspinatus. Okay, so now we're testing for scapular adduction and depression. We have the patient in a gown, we have the back untied, and we have a towel here for modesty. So basically what we're looking for here is the lower trapezius to be activated. The scapula is going to depress, it's going to come downward. Also it's going to adduct, so it's going to come closer to the body. So in order to find the lower trapezius, you can find the acromion, which is right here on the shoulder. It's easy to find. And you can follow the spine of the scapula down, which is a little bit inferior and medial. And then the lower trapezius will attach to the lower thoracic vertebrae, to the medial kind of spine of the scapula. Basically, it's the accessory nerve, cranial nerve 11, that activates this muscle. So basically what we're gonna have you do is we're gonna have you take this arm and bring it up towards your side and a little bit out just to there. Yep, a little bit more, a little bit more. That is 130 degrees of shoulder abduction. And we're gonna have you try and hold it there and bring your scapula, think about bringing this bone back here over towards your left side, if that's possible. Yep, just like that, perfect. Is there any pain?
No.
Okay, and you can rest your hand down on the bed now. Okay, so there was a palpable contraction and she had no pain elevating it, so that would be a 0 to 2. So now we're gonna test for a 3 to 5. So what we're gonna have you do is we're gonna have you do the same thing. We're gonna have you lift this arm up a little bit back, a little more, just like that. Yep, 130 degrees. And now what I'm doing is I'm on the contralateral side and I'm stabilizing here. And I'm gonna try and push her scapula up into elevation and abduction. But I want you to try and resist me, okay?
Okay.
Okay. Hold, 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 hold. Any pain?
No.
You can relax. Okay, so that, she scored a 3, a 4, and a 5. So the final result will be a 5. So basically what we're doing here is we're stabilizing from the contralateral thorax as well.